When I think about robotics in medicine and in surgery especially, I think it's just about the evolution of medicine in general. We're going to smarter systems, more efficient systems, more precise systems to make sure that we're giving the patient everything that we can.
When I'm doing a laparoscopic hysterectomy, I have basically one motion. If this is my instrument, this is what I get. With the robot, as I'm sitting in the console, my instruments are wristed. I have complete wristed motion. I can make my camera go view around corners, whereas a traditional laparoscopic camera, I get one 2D view. With the robot, I actually get 3D vision around corners that I normally wouldn't be able to do. With robotics, I'm looking directly at what I'm operating. Rather than having to look over here or look over there and coordinate my hands and eyes are directly coordinated with each other, which is huge for patient safety.
Robotics are a game changer for partial knee replacements. I think that part of being a good physician is being aware of advancements in your field. I don't think anyone wants to be treated with 30-year-old medicine if there are much more viable, better treatment strategies available. And so for me, as we get more and more data, we start to see, wow, this really is beneficial. This does help the patient, give them a knee that is specific to them. And for me, as a surgeon, I feel much more confident in the product that I'm providing with the patient because it really does take out the human error that we are all subject to.
I mean, you can do a joint replacement without robotics. It can be done. But I think the learning process of learning robotics also helps you learn even more about joint replacement. So I think it helps you become better at even doing it without robotics. The robot itself is an evolution in the process. It's not that the process can't be done the old way, it can. But the evolution towards these newer technologies is actually an improvement. So therefore, I think it will show out with time that the longevity of the implant and the patient satisfaction will be higher.
Holy Cross Hospital Jordan Valley provides us with the technology to be able to do that. This is not something that is available everywhere. And so I'm just thankful to be at a place where they support the technology that helps us give patients the best care possible.
I think just like anything else, robotics is a tool, and it's only as good as, as the person who knows the tool or uses the tool. But if used appropriately and someone who uses it and is very familiar, I think it can be a great benefit to the patient. Currently they say that about 4 out of 5 knee replacements, patients are happy, but that means about 20% are not so happy with their result. And I think robotics has really lifted that up into the 90s. And so I think it's made a difference in our field quite dramatically.
The thing about robotic surgery is it's going to help us put these implants in a way that's going to make them last longer. So that makes it so we can avoid some of the complications that happen when something wears out or breaks or comes loose. We can just avoid further problems in the future if we're being really precise when we put these implants in on the first time. And that's really the goal. We want to be one and done with these surgeries.
To be a part of the community and be able to bring that skill set to my neighbors, to my friends, to the people around me it's why I went into medicine, to help people, but I get to do it to the people, with the people around me, which is incredibly valuable. And to see Holy Cross come in and want to improve that so that people are proud to come to this hospital is incredible.